time to relearn something new as drugs come out, was saying to them, yes, there'll be a training session and you'll have tools at your fingertips so that you can take care of people as they come into the pharmacy. Our tool is called RX Advisor. You heard a little bit about care management, disease management before, and we look at that as saying, if you're a patient at home, or you've walked into our pharmacy, or you've gone to one of our infusion centers, how are we making sure your information is going with you and being transferred? We have a tool called MedMonitor Complete. We actually not only utilize it for Walgreens, but we utilize it for pharmacies around the country. And to date, about 10,000 pharmacists have access to it. And it's a tool that not only educates you about the medications and any interactions that there may be, but also in helping to manage the disease state. So we have pharmacists and nurses who interact in providing those tools and services. I mentioned our Take Care clinics, and many of you who have not used one of these clinics may not know, but there's an e-kiosk that you register in, and again, for those who go to the doctor, you know those 5-page forms that you fill out each time you go? You fill it out online, it's kept there, and it's transferred over as you come back. You can update it. More importantly, it's something that we can give you to give to your doctor or send on to your doctor or your pharmacist. We also provide education directly to patients, and we're able to really close the loop for people who may want follow-up or who may not have followed up with us based on the data we've collected and tracked. We actually have a number of peer-reviewed publications that have been delivered in the last year, not only demonstrating quality and satisfaction, but improved outcomes. We have our online pharmacists, so it's one thing to get your prescriptions and go home. It's another to want to ask that stupid question that you didn't want to ask your doctor. And we've got pharmacists available 24/7 to do that. So using a telephonic model to, again, bridge that gap for patients. I mentioned our mobile apps already, and at our booth, we've got some great demonstrations of how that worked. The coolest is just taking a picture with your iPhone of that barcode, which is automatically scanned, back to the pharmacy, and you can pick it up at any pharmacy that you'd like. I said that's the coolest because it's the one I like. Sure, they may have a different opinion. And we provide a lot of online education. And again, we're talking about where do people go to get trusted healthcare information. Yes, there's a lot on the internet, but how do you get people to aggregate it? I'm sure I used less than 5 minutes because I know some of my colleagues may need more time. But we at Walgreens, we're saying we offer you choice, convenience, and also control of your healthcare information. Thank you. That was for you, Harry.
There we go. Thank you. Yeah. I'll quickly pull this up somewhere.
F5.
I got to find the right thing here. That looks like me. All right. Okay, my name's Harry. Are we on here, by the way? Can you hear me? My name's Harry Greenspun. I'm the Chief Medical Officer for Dell. It's odd to have so many doctors on stage in Vegas and no one with a feather boa. It's a little unusual. Anyway, I'll be brief because actually, unlike my colleagues here, I actually don't do very much. Cheryl has real responsibility, Martin has responsibility, and Dick now, actually, his company now covers all of our employees, so he's got a lot of work to do. Again, I work for Dell. I started with Perot Systems. We were acquired by Dell about a year ago. And we are now, which none of you know, we are now the largest provider of health IT services globally. So we deploy EMR systems, we do revenue cycle work, we do IT outsourcing, all that kind of stuff. But also, we're Dell, right? Who's got a Dell computer? Hands flying up, love that, except this guy in the front with the iPad. And what's interesting is that there are all sorts of fascinating stuff that all of us do in our daily lives involved with healthcare, with technology that we don't get to experience in healthcare. Easy stuff too, like who's got a dog or a cat? Okay, again, any cat lovers? Because you guys can leave now, I'm allergic. But how many of you got a postcard from your veterinarian that it was time to get a new vaccination for your pet? Right? Okay, those with their hands up. How many of you got a reminder to get a colonoscopy from your doctor? Okay, and not for your cat. And there's a lot of this stuff. We talk about, is digital health here to stay? For many of us, digital health hasn't even arrived. Who likes burritos? We're not serving them, but who likes them? Yeah. Who's got the Chipotle app? Anybody? There's my man right there, right? What's your favorite burrito? What's your favorite one? Carne asada? Excellent, excellent. So what's your name? Justin. So here's what Justin can do, right? When Justin's here in Vegas and you're dying for a burrito, he can take out his smartphone and he can find the nearest Chipotle based on GPS coordinates, right? You can custom order your burrito, your carne asada burrito. It sounds delicious to me, actually. And you'll walk into that. You'll get directed to it. You'll walk into it, and it will be paid for and waiting for you, right? Now, Dick, no offense, but if I get thrown out of the Bellagio tonight and hit by a bus on the Strip, do you think I could find an orthopedic surgeon that takes your insurance? Okay. It's going to be a struggle. Okay, we're getting there, though. I'm not putting anyone on the spot, but we've got some work to do. And I've got cool stuff. I'm from Dell, right? I got a streak. Anyone seen the streak? Yeah, it's cool. They're the one guy there, not the iPad guy, the other guy, yeah. We've got cool stuff. And what we need to do is find a way to start incorporating more of the very cool stuff that we take for granted in every other parts of our lives. If Justin can order his carne asada burrito, right, and we can get all these other things, why is it that we walk into a doctor's office or hospital, it's like visiting an episode of the Flintstones? So what is amazing about the kind of work that Martin has done and Cheryl's done and Dick is doing at UnitedHealth is that we're incorporating a lot of these really interesting technologies in a way that will bring to most of us the kind of stuff that we expect. And I mean, none of you, I assume, would go to a bank that didn't have online banking. Am I right? Anyone got their money stuffed in a mattress somewhere? If so, send your address. But how many of you have access to your medical records online? Okay, rough number, 6%, okay? Based on my quick, and that's pretty normal, okay? So unless you're in Cleveland or unless you're in some other places where you have some really advanced people doing stuff, most of us don't have the kind of access to our our health care that we take for granted in every other aspect of our lives. There's the finance, travel, and even ordering Justin's burrito, right? So, or at the very least of it, it'd be great if all of us could get the same level of preventative care that we get for our dogs and cats. But think about that for a second. With that, I'm going to turn it over to Martin, because Martin actually does real work, and I think he's much more interested in listening to than I am. So there you go.
Great. So while this is being brought up, I'm a physician, a general internist by training, but I'm the Chief Information Officer. And I've spent most of my career really thinking about how to meet those challenges that Harry has talked about. And fundamentally, what we really have to do is to rethink the healthcare delivery system. So what I want to talk to you about today is really three things. The first is, what is it going to take to make that happen? And that's primarily a conversation around tools. The second thing then is a conversation around how will we actually transform the healthcare delivery system. So I didn't say access, I didn't say insurance management. I said how and where can we change the way we deliver the care and stop thinking about care as something that only happens in a doctor's office or in a hospital bed. And then the last thing is, how do we marry those two things together? And I'll end with a little story that attempts to put those together. So let me start first with the tools. So what you see here is a series of programs at the sort of beginning of the internet age. We asked the